I'd like to welcome Lindsey Parsons to the Resilient Biome podcast. Good to see you, Lindsey. Thanks for being with us.
Good to see you.
Lindsey is a certified health coach, owner of High Desert Health, and also runs a very active podcast. Every 2 weeks, she puts out a new podcast talking about all kinds of health journeys. And that's what we want to start with today is figuring out. I've listened to your podcast over the last year and a half, so I know some of your story, but certainly not all of your story. So I think our listeners would love to hear about your health journey. It always starts with a sick journey, right? Becomes a health journey, and then how that led to you becoming a certified health coach.
Sure. So I could go very far back or sort of a little bit back.
Yeah,
Maybe
whatever you think.
Back to say that before I discovered my health problems, I think it all started with living in Costa Rica and a couple different episodes of food poisoning. I think it was a later episode because I lived there. Well, I was there for a summer, and then I went back and lived for a year and a half and taught English. And I had this episode of food poisoning where I ate old mayonnaise that had not been properly refrigerated for a good day and a half by then, and made like tuna salad and had tons of it. I think that was where things started, because upon returning from Costa Rica, I remember noticing that my stool had gotten quite soft, and I'd always had bloating if I overate, but I guess over the years it became obvious that the bloating was very constant with almost every meal and such. And I went through, after that, I went through infertility. Took me 2.5 years and some assistance to get pregnant with my biological son, and another 2.5 years after him where I tried for another child. And there were 2 miscarriages during that period of time, and then ended up adopting my second child. So but I didn't do anything about my health issues during those years, because to me, it just looked like bloating and sort of stool that was not quite right. I'm sure I played with my diet and things like that. And when I was trying to get pregnant, I think I started going more organic and trying to intervene in that respect. Then it was around 2014 that I was diagnosed with Hashimoto's thyroiditis. And it was not discovered because my TSH was elevated, but rather because my doctor felt thyroid nodules, and she felt that my thyroid was enlarged. And that's when they did an ultrasound, and they saw the Hashimoto's on the ultrasound. And this is an autoimmune disease, and autoimmune diseases very commonly come from gut dysbiosis, because when your gut is dysbiotic, you have a leaky gut, things get out, that triggers your immune system. So after that diagnosis, and then at the same time, I was diagnosed with pernicious anemia, but the antibodies came like once they were positive, and then another time they were negative, which is the inability to absorb B12 in your stomach, because the parietal cells lining the stomach that secrete intrinsic factor, which is necessary for digesting B12, they are impacted in an autoimmune manner, or that can also just be from issues around dysbiosis and stomach acid. In any case, I was not absorbing B12, so I was by the time they discovered that, I was having tingling in my hands, and the kinds of neurological things that might be irreversible if they go too far.
And those were related to the B12 mostly, or both? The neurological
That's
symptoms.
related to B12, but
B12.
All of it can come from it's from deficiency of B12, but it can come from the dysbiosis and all the problems that are going on in the gut.
Okay.
So yeah, but eventually those came back not negative, but I still have to take sublingual B12. Like, I can't just eat B12 and hope that I'm going to be okay. Like, I have to take it to this day, even though the antibodies aren't positive anymore. And then eventually I saw a functional medicine person, and they diagnosed me with SIBO, and I did a breath test, and with low stomach acid, and went through the cycles of, I went through a cycle of antimicrobial herbs, and it didn't quite get rid of the bloating the way they were hoping. So then I did rifaximin, which did help quite a bit. And after that, I was determined to bring my Hashimoto's antibodies down to 0. That's when I really got into, studying the gut microbiome and yeah, I was determined to. I had read a lot about fecal transplants, and I was determined to do one from my husband who was healthy, and talked about it for 2 years, told my family about it, just kept going on about it, reading everything I could possibly find. And then finally one day I'm just like, this is it, I'm doing it. and I gave myself just a one-time fecal transplant. And the interesting thing was I did consult with my doctor about it, and he said, let's do it like an experiment. So I told him I had done it, and we checked my B12 levels, and all of a sudden they had skyrocketed.
Wow.
When I got those good microbes in there. And then we did try, though, to see if I could just take oral B12 and not the sublingual and still have it absorb, and I couldn't. So that hadn't changed. And it didn't change the Hashimoto's antibodies either. But I did go gluten-free, I went dairy-free, I did like a full elimination diet and determined that those were the two biggest factors. And for a while, I was soy-free for about a year, and I just kept testing foods against the antibodies, the ones that I had taken out, and determined that I was okay with soy. And then I just persisted in that for many years. I think for 5 years, I was relatively strictly gluten-free. Maybe once every few months, I might have a pizza or something. And to this day, I'm dairy-free most of the time. I'm definitely lactose-free, or have to take the lactose digestion tablets because I am lactose intolerant, and I discovered that around 19 or 20. And yeah, so then in the course of doing gut health work, I became a gut health coach about, I guess it's about 5 years ago now. I started health coaching in 2018, and I focused on gut health. By 2019, mid 2019, I started really focusing more on gut health. And as I did that, my SIBO would keep coming back. So I knew that I had a recurrent issue, but then the IBS SMART test came out, which tells you if you have autoimmune SIBO, which is small intestine bacterial overgrowth for your audience. And the IBS SMART test tells you whether there's something going on in an autoimmune manner that's causing your migrating motor complex to be slow and stagnate and not keep moving food through, which is how bacteria tends to overgrow, is that you have this pool of stagnating bacteria, and then you get the bloating because they're fermenting your food. So I discovered in the course of that I did have autoimmune IBS, and that's probably going to be something that's with me for life, and that I just have to keep managing it. So, and then I didn't mention, though, I did bring the Hashimoto's antibodies down to 0. I did get those negative, and they have been negative now for like 4 years.
Wow. So you mentioned, did you say something? You mentioned IBS SMART test, and the overall topic of the title is of our podcast is gut health coaching and testing. As I've listened to your podcast over the last couple of years, you do some testing and talk about some testing that I'm not familiar with, and so I want to talk about some of those things. So, but first of all, your Hashimoto's was resolved through all those interventions, or was it any one thing?
Right.
Collectively?
Well, I think there was probably a combo of things. So certainly staying gluten-free and dairy-free for an extended period of time. Then, although now I've been eating gluten, like good quality gluten, but more often. And then I also took some proteolytic enzymes. There's one called WOB enzyme that's been studied in Hashimoto's in particular to help kind of eat up I don't know if it's eating up the antibodies or the antigens, but in any case, it just helps clear the autoimmunity, basically. And so I took those for a while on an empty stomach. That's not with food. And they're like digestive enzymes, but not with food. And then just healing your gut and all that together, I think, is what reversed the Hashimoto's. And I never went on thyroid hormone. And the doctor had said to me, I said, what will happen over the long term? She said, well, it'll just get worse and worse, and then the Hashimoto's will eat away at your thyroid gland, and then you'll have to maybe have it removed and go on thyroid hormone. And I was like, yeah, that's not going to be my story.
Mm-hmm. So back to the IBS SMART test. Could you tell us a little about that test, please?
Yeah, so it measures two antibodies. One is antivinculin antibodies, and one is anti-CDTB. Now, CDTB is cytolethal distending toxin B, and it's a toxin put out by certain bacteria. I believe it's like E. coli and Klebsiella and Citrobacter, perhaps. So certain bacteria put out this toxin, and your body attacks it like it does other antigens that it finds in the body. Your immune system activates against it. And when those antibodies are elevated, you know you've got some sort of bacterial infection that's causing your immune system to react. Now, there's a protein in your body called vinculin that's related to the migrating motor complex. And it's important for the functioning of the migrating motor complex, which is that complex that, hour and a half after meals comes through and clears out, sends a cleaning wave through the intestines to move all the bacteria and the food and everything, get them out down to the large intestine. And so when vinculin antibodies are elevated, that means that you have, well, basically what happens is vinculin looks like CDTB, much like with Hashimoto's. Gluten looks like the Hashimoto's or the thyroid cells, and so your body attacks the thyroid cells. It's the same type of molecular mimicry situation where the vinculin looks like the CDTB. So the body attacks the vinculin, and then that prevents the migrating motor complex from functioning properly, which is how you get stuck in this cycle of recurrent SIBO, because even if you can clear out the bacteria, it's still going to come back.
So the migrating motor complex, you call it? Did I say that right? Okay. So that's just essentially an issue of low motility, sort of in layman's terms.
Yeah, basically, but not in the large intestine. This is not necessarily correlated with constipation. It's in the small intestine. And when things hover in the small intestine, you just get these bacterial overgrowth. That can then in the large intestine manifest as either constipation or diarrhea or loose stool.
And isn't low motility one of the main causes of SIBO?
Correct. Yes, it's pretty much always at the root of SIBO. The question is what's causing it. Like sometimes it can be caused by adhesions. It could be caused by Ehlers-Danlos syndrome, which is like a connective tissue thing. So there's all sorts of, Hashimoto's even, or thyroid, slow thyroid, hypothyroid could be causing it. Anything that slows motility could be causing it.
Okay.
But yes, it is at the root. It is at the root of SIBO.
So you had Hashimoto's, which now, do you consider yourself cured, really, or completely under control?
Yeah, I mean, they can still see it on the ultrasound, but like I had big thyroid nodules too, and I was also determined to bring those down. And recently had a little bit of a scare, except I wasn't scared in the least. But people who weren't confident about their health might have been. The doctor or the thyroid tech, the ultrasound tech, she said there was the doctor gave me the report that there was like a 3-inch or 3 centimeter nodule. And when they're above a centimeter, you have to get a biopsy. And when I first had them, there was one above a centimeter, and I got the biopsy, and it was fortunately negative, which was a particular concern because my sisters had thyroid cancer. But I had that ultrasound, and the doctor was like, you got to get in right away and get a biopsy and see this other doctor and blah, blah, blah. And I'm just like, no hurry. I'm going to take some time, and I'm going to shrink those nodules. If in fact there are nodules, if this is a good diagnosis. Well, it turns out I saw the other doctor. He says, oh, that's not a nodule. That's just, you can see the damage from the Hashimoto's. That's what that is. There's no 3 centimeter nodule. You're fine. I'd love to do procedures, and you're giving me no reason to do one.
Wonderful. Wonderful. Yeah. Feels good to have some control over those things, right? Which I know as a health coach is what you're trying to give your clients.
Yeah.
Yeah, for sure. So you said you think you'll always have this autoimmune IBS, and what is actually being impacted to cause the IBS? What cells or whatever?
So it is that migrating motor complex. The vinculin, the protein that is related to the migrating motor complex, is what's being impacted.
Thank you.
At least in terms of the research that Mark Pimentel at Cedars-Sinai has done. It may not be definitive, but it's what we have as the best information right now on what's causing autoimmune IBS.
So then how do you change that low motility? And that would be the case for any of your clients.
Right. You can use prokinetics. That's the biggest thing. So these are things like iberogast, or people who have constipation and low motility can use things that include 5-HTP. There's supplements like Modal Pro or GI Motility Complex or Motility Activator. And these typically have ginger, or some have artichoke extract, which helps with stomach emptying, and some have 5-HTP, which, as I was mentioning, those are good for people who have constipation, because that can loosen the stool. So these different, prokinetics are taken either, and iberogast, that's the one I take. You take it before bed, or you can also add it after meals. And if you're having bloating, if you're having, just as a preventative to sort of do that cleaning wave at night, you can also make sure you space your meals out well and not snack. So you want to have, ideally 4 to 6 hours between meals, or, as much as it takes to actually get hungry again, not just to be popping food in your mouth just because you walk by the kitchen. And going to bed on an empty stomach is important. And then you can also, you can implement a low FODMAP diet, but it's not good to, live on a limited fiber diet long term. So I think the more important thing is just knowing which foods really set you off, and not combining tons of those into one meal. So like a low FODMAP would include no garlic and onions, for example, which is an impossible way to live if you ever want to eat anywhere besides your own home.
I agree.
So, I can eat garlic and onions okay, but if I have dairy and gluten and all that stuff, I'm gonna blow up, and even if I take my pills, my digestive enzymes.
Now, you said a large intestine, small intestine motility aren't necessarily linked. If a person doesn't suffer from constipation or bloating, can they, in any sense, assume that they don't have SIBO, or that really is completely unrelated?
I would say the only SIBO that I tend to see that might not include bloating is the hydrogen sulfide SIBO. Sometimes that doesn't have, it usually would have loose stool and diarrhea, but it might not include bloating. It usually includes some amount of discomfort and pain, and sometimes things like rapid heartbeat when you eat, but it doesn't necessarily always have bloating in my experience. If you have methane SIBO or hydrogen SIBO, pretty much you've got to have bloating. If you don't have bloating, maybe you're one of those rare people whose system just doesn't blow up. I don't know, but it's pretty rare. For me, that's one of those defining symptoms. Often you see dysbiosis without seeing SIBO per se. That would not necessarily have bloating.
Okay, thank you. I tend to, you and I are in the gut health, especially you in the gut health arena. So of course we hear about SIBO, but I seem to be hearing and reading about it in non-nerdish type arenas, so people are talking about it. A lot of times I don't think they know what they're talking about as they talk about it. But so there is no, so it's like one of these, I guess people are becoming aware of. It's probably always been there. There is no definitive test then, because you're talking about many different symptoms, several different tests. So you have a client that comes to you, and maybe just talk about what a typical client might look like for you, and the different directions you might go with them.
Okay, so before I get there, let me just say that there is other testing for SIBO. There's SIBO breath testing, and there's one called the Trio Smart, which has all 3 gases: the hydrogen sulfide, and methane. And even when you use that one, you still might get a false negative. You won't get a false positive. Like if you get a positive, you've got it. But you may have a false negative on that. I've certainly had clients who got false negatives on that and still had symptoms of hydrogen sulfide SIBO. And when they used the supplements and went on the diet that resolves that, it went away. So it's clear to me that there can be some false negatives. But anyway, in terms of just a general client who comes to me, some of the tests that I take a review of symptoms. And if they have bloating, I might consider a breath test, or I may consider a stool test. If it's really obvious to me whether it's going to be hydrogen, methane, or hydrogen sulfide from the symptoms, I might not go the route of the breath test, it is kind of, it's not great for a lot of people. For one thing, you have to either take 25 grams of lactulose or sucrose or glucose. And for somebody who's been struggling with their gut and or can't handle sugar, giving them 25 grams of glucose is kind of traumatic. So that's one issue to take the test. Also, the fact that there are a lot of false negatives, and because you often see invalid results on the actual, if you breathe into this bag and save it, and I see invalid results. So there's just a lot of reasons why it becomes troublesome. There's also the food marble, which is a device you can buy, and I'm sending more people that direction because I'm seeing some of the leaders in the SIBO world start to use that. So I might have people buy a food marble, then they can retest themselves. It's like the same cost as one SIBO test, but you can test yourself over and over. It does not include hydrogen sulfide, however. It's just the hydrogen and the methane.
A food marble. Can you describe that a little bit more, please?
It's a little device. The company's food marble is actually called the Air 2, I think is the current device. And it's just a little device you breathe into, and it does the SIBO test right then and there, and then it uploads the data to my practitioner dashboard, and I can see the results right away. I have one, and I've been playing with it and using it, and when I feel bloated, I test myself, and I'm like, that's interesting. I'm bloated, but I'm not getting a positive reading. Or other times I'm like, oh, I bloated and I got the positive reading on the hydrogen and methane. So it's just interesting to see that sometimes there's bloating that I have that's not necessarily related to excess gases.
So it's reusable. That sounds like a game changer for testing.
Yeah, I think it is. I think it is. It's funny though, because I've suggested it to a lot of clients and they will say, well, is that as reliable as the other? Because maybe they've heard something, or I don't know, but my inclination is, even if it's a little less reliable, just do another test, right? Like you can just do another test and you can test the food as you're eating. And if you get a positive result, then you can still see you've got elevations. And I think that what I'm seeing though from the experts in the SIBO world is that it is more reliable and yeah. So.
And how many times, there's no like cartridge load to it. It just keeps working?
No, it keeps working. It just,
wow.
You know, you have to wait a few minutes to use it again. They only want you to use it once an hour, so they don't want you using it constantly, but yeah. So it kind of recalibrates itself, I guess.
Yeah, that's amazing.
So I like it because you also can get the results immediately. You don't have to wait 3 weeks.
It reminds me of sort of a continuous glucose monitor where you get, again, not constant feedback, but almost constant feedback.
You're getting data. Yeah.
Yeah.
So there's that. So those are the options in terms of SIBO. If I see someone who has symptoms of gut stuff but no bloating, then I would almost always go to a stool test. And I used to do the GI map all the time, and I like that because it had the H. pylori included. The GI effects has some markers like the short chain fatty acids, like butyrate, that I liked. And if somebody had no suspicion of H. pylori, I might have gone that direction, but it was more expensive. But now there's a test that's sort of in between the price of the GI map and the GI effects, and it has all of those things. And it has zonulin, which is a marker of leaky gut. So I like this. It's this US Biotech GI Advanced Profile. And it's got all of the phyla too, which the GI map didn't have. It just had the Bacteroidetes and the Firmicutes, whereas you can see the proteobacteria level on the US Biotech test. So anyway, I've moved to that test as a stool test. So, you know, it shows all the potential pathogens, all the parasites, the worms, all that stuff. And then it also has all the main bacteria levels that you might want to know, the keystone species, the dysbiotic ones that are common, the really pathogenic ones. And then it's got the intestinal health markers, which includes like fat in the stool and the pancreatic elastase. So you can see how their enzymes are, whether they're digesting food properly, and see if there's any suspicion of low stomach acid. And it's got the secretory IgA to see how their gut immune system is working. It's got a marker called calprotectin to see if they might have inflammatory bowel disease, because that happens too. Like, it's relatively rare. Most people, by the time they come to me, they've seen someone that has diagnosed them with like Crohn's or colitis. But occasionally I'm the one who discovers that they have that elevated marker and say, okay, you need to go back to a gastroenterologist and get a colonoscopy and see if in fact you do have colitis or Crohn's. So occasionally, because of that, I do suggest they get further testing. And then if I talk to somebody and they have signs of candida, which would be if they have a history of yeast infections, or if they have thrush, obvious like white coating on their tongue, if they have carb cravings, a history of a lot of antibiotics, or long stretches of broad spectrum antibiotics, or if they were on antibiotics like for acne for an extended period of time, or if they can pinpoint that after antibiotics the problem started, that I might, and I suspect candida, then I won't just get a stool test. I want to see an organic acids test. And I use the Organics, which is the Genova brand organic acids test, or one of its more advanced tests that has other markers like the metabolomics that includes amino acids. And you can also get add-ons for fatty acids and for urine elements, including toxins and minerals. I used to do the NutriVal too a little bit more, but it's become a bit of a pain for people to get a blood draw and all of the centrifuging and everything else. So metabolomics is just blood spot and urine, so I use that. So it's urine amino acids, and it's not as good as plasma amino acids, but it's still better than having somebody just not be able to do it because they can't get the blood draw and get it all together.
Back to
and
the
then there's vitamin.
Sorry,
vitamin and mineral levels on the metabolomics too. So I like that.
Okay, yeah, very, very thorough. Back to the GI map and the current one you're using. Is that a PCR technology? Is it?
So it is PCR for the microbes that they're looking for. Yes, it's not a shotgun sequencing metagenomic affair. I really, I'm sure that perhaps a more skilled practitioner could handle the metagenomic sequencing and what to do with the data. But for me, it's sort of like too much information. Like there's not a lot of, like I need information that has some sort of, okay, this is what you do if you see this information. Whereas, some of the metagenomic sequencing, I haven't even heard of some of the bacteria that are showing up as majority, it's huge components of the microbiome. There's not research been done on them, so there's not a lot of use for the information. Whereas there is information about these other things. Like if I see low levels of Akkermansia or of Polybacterium prausnitzii, I know what to do with that. I don't know what to do if I hear of some random bacteria that's got a lot in the gut and, may or may not, there's not been research on it. So
yeah,
that's why I don't use it.
Yeah, that's very helpful. I'm used to 16S tests and more recently the shotgun test through Tiny Health. But I can see how useful that is, especially when you've got the calprotectin and some of the other things thrown in there. Yeah, I get that. What is what would you say sort of the success rate with the typical client?
So I actually did one podcast because you get that question sometimes. And I did a whole podcast where I literally went back to my entire database of people and I wrote down, okay, gut issues, other issues, was it resolved? And I think I went through and it was something like 80% of my people, their gut issues were resolved, and maybe, of the other conditions, I can't recall what the number was. But it's so variable, and I will tell you why. Number one, follow through. There are people who come and they pay for, 3-5 appointments. They see you once and they never appear again. And you follow up and they don't respond. I have no idea why. I don't know if it was a bad experience for them or if life happened. You just don't know. Then you have people who you do see occasionally, but they just can't seem to follow through because like maybe they got sick and then they stopped taking all their supplements and then they, or it just takes them months to get things and to do it, or they just get supplement fatigue, or the diet that you suggest is too cumbersome for them or whatever. And I'm totally willing to work with people and try and do things more slowly and incrementally and work around what their limitations are. But sometimes people, I think, are so used to the traditional medical model where you have a doctor who walks in and tells you, this is what you must do. And if you dare to come back and say you didn't do that, they're just like, well, I don't know what you're doing with yourself, but you shouldn't be trying to intervene. And I'm the expert here. I'm not like that at all. I'm completely willing to work with people, but I think people are so used to that model that they get scared when they don't do what they're supposed to do. And so they're afraid to come back and say, I didn't do it.
Don't want to get scolded by Lindsey.
Yeah. Yeah. And then, which I don't do, of course. And then I guess the other situation too is that people often have reactions to things because, you have people with histamine reactions where they get sort of allergic reactions to stuff. You have people who, for various reasons, just are having trouble doing what you tell them to do. And so you need to adjust. And so sometimes that whole process can take a long time. And so it just, you don't necessarily see them through to the full end of what's going on. And admittedly, there's also people, especially people who come with really complex conditions. And so I get sort of the most complex people. Not always. Sometimes people are just simple SIBO case, you know, they take some supplements, they're good, never see them again. But other people are more complex, like they come in with chronic fatigue and with mental health issues and with pain and all that kind of stuff. And it's just a slow process. And they've been that way for 20 years, and you're not undoing it in the course of a year. Like, it might take a couple of years to undo it.
Yeah, and that totally makes sense. You would have that variety of response, and it's not fair if they don't even follow through or follow the protocol. I mean, that wouldn't be the case if you're doing some scientific research on, you know, this antibiotic works or not, and a patient stopped taking it after 2 doses. Well, they're not even in the results, you know, so it's not fair.
Right. I think I pulled those people out of my numbers.
Yeah, right. And that's really what you should do. So anybody, pretty much everybody that comes to you, maybe partly because of your gut health podcast, begins with some gut related issue. Is that why they're coming to you usually?
Usually, occasionally I get somebody who doesn't actually have any obvious gut symptoms, but they think maybe there's an origin in the gut. So they might have normal stool, they might have no bloating, but they think, well, I've got this thing and I keep hearing in all these podcasts or whatever, YouTube videos, that the brain and the gut are connected, or that the fatigue and the gut are connected, or whatever it is. And then they find me then because I know I'm a gut expert. But yeah, but occasionally I get people with just other issues.
Do you have a couple of favorite client testimonials, you know, a really amazing turnaround you'd like to share?
Sure. I'll talk about one guy who I finished up with recently. Started about a year ago, and he had a diagnosis of colitis, which is one of the inflammatory bowel disease conditions. He had intestinal methanogen overgrowth, which is one of the forms of SIBO. They used to call that SIBO-M or SIBO-C for constipation. And, you know, he just a lot of bloating and discomfort with eating. He would get histamine-like reactions, like a stuffy nose and a lump in his throat when he ate. He had more and more food sensitivities. He really could eat a very limited number of foods. When I tested his gut, he had high levels of H. pylori. He had the beginnings of autoimmunity. He had positive Hashimoto's antibodies. He had a positive ANA, which is anti-nuclear antibodies. And, you know, it's just sort of the opening test to see what kind of autoimmunity you might have. Brain fog, anxiety, like debilitating panic attacks, depression, anhedonia, or just like a reduced ability to experience pleasure. He was always cold. He had muscle and joint pain, weakness. He had fatigue. So he was just a mess.
Yeah, that's horrible.
And he had been to all the allopathic doctors. He'd seen gastroenterologists, immunologists, rheumatologists, like all those, and not gotten any help. And when I first met him, he was in like a black room, and he was like, I think he was wearing a hoodie, and he just looked so sad and miserable. Like his life had been confined to this room. You know, he used to be athletic. He used to be an active guy. And anyway, so yeah, we tested his gut and saw, you know, there was the intestinal methanogen overgrowth, there was the H. pylori, so we had to deal with all those things. And also there were, you know, deficiencies in amino acids. There were deficiencies that indicated why he was having these, you know, anxiety, the panic attacks, the depression, because his serotonin levels were low, his dopamine levels are low, and those are all mediated via the gut microbiome. 95% of your serotonin is produced in the gut microbiome. And so, and he had been on an SSRI, and by the time he was done with me, he was able to come off of that, and that had caused him to gain 30 pounds. So that also had been really unpleasant. But he was able to come off of it, and you know, in the final meeting, he said his bloating's gone. He's feeling so much better. He can eat a lot more foods, and he's also done some stuff on his own. I won't say that all of this is to my credit. I think a person who takes an active interest in researching other things and doing things on their own too really gets much better, much faster. And he did things like do ice baths in the morning to bring up his dopamine. He's been working with a therapist. So he's been in a lot of ways advocating for himself as well. People come to me and they suggest supplements. And sometimes I don't dare I don't dare, recommend supplements because they're really expensive or they're more experimental. So, sometimes they come to me and say, what do you think of me taking this? And I'm like, yeah, I think that would be beneficial if you want to do it. So yeah, so that would be one example. And the last time I saw him, he looked a lot brighter, a lot happier, not wearing a hoodie in the middle of summer anymore.
Oh man, very satisfying story. Now you said you don't recommend supplements, so how do you recommend anything to a client? Take this or don't take this?
Oh, well, no, I mean, I educate people about supplements. I mean, I don't sometimes recommend, like the one he was taking is a peptide called BPC 157. So I don't often recommend that particular one because it's a peptide, it's expensive, and I don't know, it's probably past the point of being experimental, but it's not, it goes beyond the average gut health supplement, let's put it that way.
I gotcha. So you do recommend things all the time. That's how you treat somebody.
Yeah, I educate people about what supplements do what and what the protocols the practitioners use are.
Yeah. Any other stories? That's a great one. Anyone else you want to throw out?
Yeah. Well, there's one I interviewed her on my podcast, Anne Marie, so I'm sure it's okay to use her name. She came to me with constipation that was really bothersome and bloating, and I'm pretty sure there were mental health issues as well, maybe some anxiety. And she had H. pylori, and that turned out to be the big thing for her. And we went through some rounds of antimicrobials, and the H. pylori was cleared. And, she just was so much happier. And she was so thankful and so happy because people who are constipated and bloated are really quite miserable. Mm. There's sort of a particular torture to not being able to empty yourself because every day you're having toxins build up that are not leaving the body. And so that has an impact on your overall health and you feel it. So that was one that was like super clear cut. Like, we just kind of went by the book and everything came through very well. And I think she had a lot of reflux too, and a lot of acid and such. That also is a real strong sign of H. pylori if you're having reflux.
So you do some fist pumps at home on those kind of stories.
Yeah, no, I mean, I love when it's clean cut and it's not complex, because most of them are complex. Most of them, it's not just a straight line. Most of them, it's sort of like, up and down, trying to figure out like, okay, this thing isn't working for them. Let's try that thing.
Mm-hmm. I had not severe IBS, but on and off for years. And I don't know, 15 years ago, I went to just the regular physician, and he says, "You don't need surgery," and that's literally all he told me. So boy, I've come a long way. I love the fact that the first testimonial, you said he's been to allopathic doctors, functional medicine. So even there, they weren't quite catching it, so it wasn't just at the traditional docs. So that's extra
no,
cool.
I don't know if I don't think he'd seen functional medicine people. He'd seen immunologists and rheumatologists and stuff, but I don't think he had been the functional medicine route. I'm not positive though. I mean, which is not to say I don't see clients who have. I see clients who've seen. I have one client who also sees Mark Hyman.
Oh, yeah.
Yeah. And I love that. I'm like, seriously? Like Mark Hyman's clients are coming to me? Yeah, that was fun. He's seeing them at the same time, but I mean, I'm just much more accessible, right? Like you go to these famous people, you're seeing people who work at their office, probably not them. And it's just really expensive and they're not very accessible. Whereas I'm there, I'm answering emails, I'm accessible.
Sure. So do you stay, has your client base just continued to rise since you started?
Yeah, I mean, I pretty much am always booked up, a month or two in advance. I only actually see 3 clients a week because of the time it takes to prepare and follow up on those clients. It really is a very high touch, interaction. So, especially I'm actually preparing to get married and go on my honeymoon, so I'm really booked up right now. But yeah, I mean, because of my podcast, there's a pretty steady flow of clients.
So you're not so famous as to hire 10 people under you yet, but
I have not yet. I nearly hired a virtual assistant, but mostly I've been working with interns who help me produce and publicize the podcast. That's the main role of the intern, so that I can get some other stuff done.
Do things
And
that,
then I also,
yeah.
oh, I also started selling a couple different supplements, and so that also sort of takes up some time to organize.
Yeah, right. Actually, I wanted to ask you about that. I remember when on your podcast, the Tributerin Max supplement came out, and then just found out from you that you have a new one called Serum Bovine Immunoglobulin Powder. I would love just to hear how you came, why you decided on those two, how you brought them to market, that sort of thing.
Yeah. So Tributerin Max, I decided on because, for one thing, that was something that I had to take all the time. So I've always tended towards the looser stool, and it's something that really, just without fail, slows motility and firms up the stool. And so without necessarily being able to constantly monitor SIBO and keep it in check, or not wanting to constantly take antimicrobials, that's like a really good kind of daily supplement for me. And it was expensive. The cheapest you could find on the market was at least $50 a bottle, and you were getting maybe 500 milligrams, 60 of them, 90 of them. Some of them were selling for more like $70 a bottle, the ones I really liked. So I just thought I could make this supplement, and I could make it a lot cheaper for my clients. The other thing was you had to take tons of pills. So I was finding I had to take 1,500 milligrams, maybe twice a day, to get any effect or to get the effect I wanted. And that was like 6 pills. And I thought, well, if I could reduce that, I thought maybe I might be able to make 1,000 milligram pills, but they told me 750 was the most they could do. So I thought I'll do a higher dose pill, and that way it's fewer pills, because, you know, when people are on antimicrobials and they're on nutritional supplements to make up for deficiencies and all that, amino acids, it adds up to a lot of pills, and the fewer you can take, the better. So that's really what inspired me to make Tributerin Max, and I thought about it for a good year and a half. If I'd done it a year and a half sooner, probably there wouldn't have been 17 other people who came to market right when I did. But when I first looked at it, there was maybe 5 companies selling any form of Tributerin. But anyway, so butyrate is a short chain fatty acid, you know, that your microbes produce from fermenting fiber, and Tributerin is a better absorbed form of that. And so there's some Tributerin supplements, and there's some that have other ways of packaging up butyrate.
Can I interrupt you there?
So anyway,
it's a better absorbed form than even the bacterial metabolites?
Oh no, of course, obviously, if your bacteria is producing it, that's the ideal situation.
Okay, better absorbed than what?
Than like sodium butyrate, or there's other forms.
Other types of supplemental butyrate. Okay, thank you.
Right. So anyway, I just looked into it, and I found a company that packages and puts together supplements for you, and I finally found one that could make a small enough batch that I could afford it, and took a credit card out, and that had no interest for 15 months, and just on a wing and a prayer, I ordered 500 bottles and thought, well, the lowest selling one on Amazon is probably selling about 30 bottles a month. If I can do that, I'll pay off my loan before I have to, you know, start paying interest on the credit card. And sure enough, within 6 months, I paid off my loan, and, you know, and it's been a great side hustle, because, you know, at the end of the day, as a gut health coach, my time is limited. I can't, like, I keep thinking, could I take on a 4th client each week? But I think, well, not with all the podcasts and the newsletter and the follow-up and the marketing and everything else, unless I hired somebody. And so I'm wavering at that point where I'm almost ready to do that, but haven't yet taken the plunge.
Yeah, that's fantastic. Is there any way to calibrate, you know, on some of these 16S tests, they'll, like Ombre, for example, they will add up all of your butyrate producing bacteria and give you, this is how much butyrate you produce. Now, it doesn't actually tell you in milligrams or anything what you produce, but is there any way to put a, you know, an equivalence, you know, this is close to taking this much Tributerin, or no one's even studied that?
Well, they do know roughly what a physiological dose is, and I think it's probably more in the 600 or 800 milligram range. Would be something like what your body might produce. People who have bad dysbiosis, though, in the large intestine, in particular, people who have an overgrowth of proteobacteria tend to have way more or way less butyrate than they should, because there's like a cycle whereby you start getting a really oxygenated colon. And because there's not enough butyrate, because these proteobacteria overgrow and they're not butyrate producers, the colonocytes, the cells lining the colon, can't get enough butyrate, which is their fuel. That's their food. And so instead of butyrate, they pull in oxygen. So you get oxygen in the colon, and that promotes the growth of facultative anaerobes, or bacteria that can live in the presence of oxygen, which are the proteobacteria. And so those get overgrown, and then you lose more of your butyrate producers. So taking supplemental butyrate can turn around that dysbiosis. So, like I did a 16S test, I don't know, maybe like 5 years ago, and my gut hit like 50% proteobacteria.
Wow.
That's a lot.
Wow.
I don't even know if that's physiologically possible, but it was a BIOHM test.
Mm-hmm.
And anyway, my latest one, I just did the Tiny Health one, and I think it was like 2% proteobacteria, so much better, because I've been taking butyrate. So my colon is nice and hypoxic or oxygen free, and I've got the butyrate producers on board. But the SIBO, I think, it causes the downstream effect. So I like the slow motility effect of Tributyrin, because it definitely firms up the stool. So that's my one supplement. My other one, my newest one, serum bovine immunoglobulins, that is a powder that's derived from the plasma of cows, and it basically takes their immune system, their IgG cells, immunoglobulin G, which this is your innate immune system. This is the immune system that knows about all the pathogens in the world and has already formed antibodies and is ready to attack them when they come around. So you basically just extract that from the plasma, make it into a powder, and it does exactly what it would do in the immune system of a cow. It attacks all the pathogens, which pretty much are the same pathogens as we attack. So, I mean, anything from salmonella to, C. difficile, to other, pathogenic bacteria that you may have, and you may not know what that is or even need to know what that is, but SBIs will attack them all, including candida. They've done some work on molds. I think there's some beginning work on parasites. So basically, whatever it is that's dysbiotic in your gut, it will take care of it. And I just had a guy from the company come on my podcast, and he talked all about, his work as a nurse, where there's actually the first product made with this is a product called Interrogam, which is a prescription medical food, and they'll give it to you at like 5 or 10 gram a day doses, and they give it to people who have Crohn's disease, ulcerative colitis, who have IBS, who have SIBO. They've done clinical studies on all these conditions. So it's had like an IBSD after 10 grams a day for 6 weeks, the bloating reduced, the loose stool, the hard stool, the flatulence, the incomplete elimination, all that stuff. So it's just an amazing supplement. And what's amazing about it is it doesn't attack your good bacteria, whereas a lot of these harsh antimicrobials like oregano or really high dose berberine, all this stuff just can upset your native flora, whereas the immunoglobulins are not going to do that. So I was more and more moving towards using this with virtually every client. And again, this is an expensive supplement. Selling for, at the time that I started looking into doing the thing, you would basically get a dose that at the lowest dosage was only a container was going to cost you, my clients, maybe like $55. And that was getting it at a discount on full script through me. And I thought I can do better for them by making it myself. And so I looked into making it, and I had to buy 25 kilos at a time, but I went straight to the company and ended up, to save money, just ended up packaging it myself in a sanitary place, with a mask and gloves and all that, so that there would be no cost of sending it out. But launched that about a month and a half.
Yeah, wow, that's fascinating. I've never heard of that. Do you know, would it also help strep in the gut, presumably?
I believe that is one of the pathogens. Yes, that's one of the pathogens that it binds to, yes.
Okay, I think I'm gonna place an order today. I've only done one Tiny Health, and I don't know why, because I'd never had, and I'd done like 5 16S tests before that, and never had any strep issues at all. All of a sudden, I think I've got like 8%, and they're saying, yeah, take oregano, blah blah blah, and I haven't done anything, and I don't know there's any symptoms per se, but that really sounds great. Yeah. And
Yeah,
I
yeah.
love how you are the way you're approaching your two supplements. Perhaps you'll branch out, maybe you'll stay at those two. But you're thinking what clients need, what works. I can do this less expensively. So very client-based sort of marketing there. So I appreciate that.
Yeah, no, I give my clients bigger discounts than everybody else on my supplements so that they can get them as cheaply as possible. Since I know it is a burden to have to pay for a private health coach, it's a burden to have to pay for supplements. So I want to be able to make that as accessible to them as possible.
That's great. I'll definitely have to listen to that podcast, the one you just mentioned there. Before you're talking about sometimes you see a patient that you recommend back to a GI specialist, possibly have Crohn's. Would you take on a patient with Crohn's in a supplemental way? I mean, I've heard of some other, I think it was somebody on Mark Hyman's show that she was able to eliminate, I think she's got like a 75 or 80% success rate in eliminating Crohn's through her care. Have you ever taken on that?
I have not had many clients with Crohn's. I have one who I suspect may have it now, but colitis I've had at least a few, and one that we've successfully gotten her to the point where she has solid stool. It used to be bloody mucousy stool and that kind of stuff. She has solid, regular, firm stool. She has, she's symptom free, but it does take a good bit more management. It involves diet. Often it involves low dose naltrexone, which is a prescription that people have to get on their own, which you can get online, and then also just if there is dysbiosis, dealing with that because in my opinion, there's always dysbiosis at the root of these conditions.
Mm-hmm.
But when you have Crohn's or colitis, the other tricky part is fiber irritates the gut. So it's hard to heal it up with the usual methods. You have to actually go on basically a fiber-free diet. But yes, I deal with clients with all types of gut health issues.
Sure. Yeah. No, I didn't know he had to go on a fiber-free diet. Wow. Talk about counterproductive there, counterintuitive.
Yeah, at first when you're in a flare, then you go back on the fiber slowly after you've gotten out of the flare.
Gotcha. So something like an ulcerative colitis, is it just a really bad type of leaky gut, or is there something else going on there?
I wouldn't describe it as a kind of leaky gut.
Okay.
Leaky gut is more the result of dysbiosis. When you have gut infection, then your gut becomes more permeable. But it is an autoimmune disease. So it is an autoimmune attack on the cells in your colon. So people will have visible sores. Now there's different types. There's ulcerative colitis, there's microscopic colitis, there's collagenous colitis. So some of them, you can have colitis too in response to a bacteria. So it's basically, an inflammatory process that involves ulceration. So you can have that in response to like C. difficile, like C. difficile colitis. So sometimes it's like an obvious pathogenic bacteria that doctors would treat in the hospital. They would never end up with me because the doctors know how to deal with that stuff. But then in other cases, it's not from an obvious pathogen, but that's at the origin. Same with Crohn's. I had a researcher whose son and him together, I guess, founded the company Biome, Mahmoud Ghannoum, who's at Case Western Reserve, and he did research on the plaques and candida in Crohn's, and he found that they were like biofilms containing a form of candida and a couple pathogenic bacteria, including H. pylori, that were in those biofilms. And so he developed a probiotic that in particular addresses that dysbiosis. So I do believe that at the root of both of these conditions, there is dysbiosis. And there's also genetic components. And there is some form of leaky gut. Of course, with all autoimmunity, there is an infection, which leads to the leaky gut, which leads to the escaping bits of inflammatory particles from bacteria, food, and all that. And that's how your immune system gets set off and leads to autoimmunity.
I knew that Crohn's was an autoimmune disease. I did not know that ulcerative colitis was an immune disease. So
yeah, they both fall under inflammatory bowel disease.
Okay. But in general, Crohn's is worse, right?
It can be much more debilitating because you can
Hmm.
have fistulas and strictures and such. And so often people with Crohn's end up having to have, different ostomies, having sections of their bowel removed. And I had, at the very beginning of my practice, there was a poor woman in the UK who already had lost her colon and was about to have to lose the rest of her intestines, and, was in real bad shape.
Not to mention $150,000 worth of infusions they have to take for the rest of their life. The Crohn's
Oh, right. If
patients.
you go that route. Yeah, for
Yeah, if
sure.
you go that route.
Yeah.
Yeah, exactly.
Yeah. Yeah.
Hmm.
You don't necessarily have to go that route, but yes, that is the allopathic way to handle it is these biologics. And the problem with those, of course, is that they suppress your immune system. So the long-term result of that is getting cancer. So the ideal is figuring out what's going wrong with your gut and fixing that so you don't end up getting cancer.
Wow. Wow. I did not realize that. Yeah. And it's, you know, again, we're dealing with, we touch on this a little bit, the allopathic mentality and people stuck in that. But I think especially when somebody hears autoimmune, they just panic, right? It is like there's no cure. I don't know why that hits me as one where people give up too easily. But you're really dealing with a lot of your clients, it sounds like, have some sort of autoimmune issue.
That's pretty common, yeah. I see a lot of eczema, psoriasis, certainly inflammatory bowel disease, and Hashimoto's. Yeah, a lot of that.
Any success with asthma or arthritis?
I can't recall if I've had anybody with arthritis, rheumatoid arthritis for sure. Yeah, I've seen
Oh,
that,
sure,
and
sure.
definitely seen that get better.
Okay, okay. We didn't talk a lot about diet necessarily, sort of implied throughout, but I just have a simple question. How evil is sugar?
Unfortunately, it's very evil. Now, some people handle it better than others. Some people are just genetically better inclined to handle it. It's inflammatory. If you have too much of it and that and white carbs or carbs in general, you get blood sugar dysregulation, which then can lead to symptoms like IBS. Of course, it can lead to all the chronic diseases that we know about, from cardiovascular disease, obviously type 2 diabetes, cancer. I mean, basically, yeah, there's nothing good about sugar. And the thing about it is it's not even necessary anymore. Like, you go to the store, there's keto ice creams. I mean, admittedly, there's sugar alcohols, they're less ideal, but if you're going to eat something sweet, like, there's so many other options now. There's stevia drops that taste, they're not bitter, they're not bad anymore. They've got like good ones now. Xylitol, you can bake with that, 1-for-1 with sugar, tastes exactly like sugar, doesn't have the effect of sugar. Yeah, it loosens the stools a little bit, but hey, if the choice is type 2 diabetes or loose stool, which would you pick?
Xylitol's in
So
my
yeah.
morning coffee. Yeah. Yeah, that's been good. I cut down, I estimate 70% on sugar a few years ago, and my lifelong migraines were instantly gone. So
Wow.
I knew immediately how evil sugar is. Yeah, I don't have to read any research to know that.
Yeah.
Is there anything else, Lindsey, you'd like to share that we haven't covered yet? This has been really helpful.
I would say just the only thing is, if you have some kind of chronic condition, to not give up. That, there's always something you can do from the functional medicine, naturopathic medicine, integrative perspective. There is nothing that's hopeless, in my opinion. I mean, other than maybe a terminal cancer diagnosis. But,
Mhm.
there's even amazing stories of cancer being turned around, and the gut microbiome is implicated. Like immunotherapies, for example, you've got to have the right gut microbiome for those to work. So they're even doing fecal transplants prior to immunotherapy for some people in experimental studies. So really, there's a lot of hope for turning around chronic conditions if you go the route of seeing some alternative practitioners.
And we're in a good season, are we not? I mean, with the microbiome research and I've seen statistics where the research is growing exponentially And, and everybody approaches it, thankfully, with a lot of humility. It's like, we don't know yet, but we are finding out tons of stuff. So that's very encouraging. I will make, so people can contact you through High Desert Health. Just Google that, right?
High Desert Health, yeah, highdeserthealthcoaching.com is my website, and my supplement site is perfectstool.com.
Okay, you've got that separate. Yeah. And that's how I found you. I'm just looking for gut health podcasts to listen to. So I'll make sure to get all that in the show notes. So again, Lindsey, super helpful. Thanks for your time. Appreciate it.
My pleasure. Thanks for having me.
Yeah, absolutely.